Does standard chemotherapy for patients with breast cancer affect how well they think, how well the brain functions? This is a question that has been troubling both patients and doctors for several years. Commonly called chemo-brain, the question arises whether there are strategies that can help improve cognitive function in breast cancer patients post-chemotherapy. Encouraging news comes from a Stanford University study that was conducted by Dr. Shelley Kessler and published in the journal Clinical Breast Cancer. In the study, breast cancer patients who have received chemotherapy treatment displayed improvements in executive functions after engaging in cognitive training. Executive function corresponds to verbal fluency, cognitive flexibility, and processing speed. Chemotherapy has been found to create changes in the brain structure and can diminish brain function, affecting a person's memory, attention, and processing speed. For this study, Dr. Kessler and colleagues divided 41 breast cancer survivors into two groups. One group was receiving active treatment while the other group was on a 12-week wait list. Over the course of 12 weeks, the study subjects completed 20 to 30-minute sessions of 5 exercises, 4 times a week. The study results demonstrated that breast cancer patients made significant gains in their executive functions, word finding, and processing speed. Researchers also observed a progressive boost to verbal memory and a decrease in symptoms of everyday functional problems in the active treatment group when compared to the waitlist group, who received no cognitive training.
The study that I did was 12 weeks, and we randomized breast cancer survivors who had received chemotherapy to either doing Lumosity or being on a wait list and then doing Lumosity later. And we found that the patients who did the Lumosity curriculum showed some improvements in executive function as well as processing speed and word finding. There was a trend for an improvement in memory, and there were some small effect sizes related to a decrease in depression. The next thing that I'm doing is trying to, of course, boost those results.